Top 5 vitamins every diabetic should take. Have you ever felt confused about which vitamins might help you manage your blood sugar more naturally? By the end of this video, we'll answer these questions and more. Diabetes is a condition where the body struggles to manage blood sugar levels effectively, leading to spikes and dips that can be hard to control. Lots of people with diabetes look for ways to support healthy glucose levels, and one good strategy is making sure you get enough of the right vitamins. According to the World Health Organization, the number of adults with diabetes jumped from about 108 million in 1980 to 422 million in 2014. If you're looking for a reliable, research-based approach to vitamins that may help regulate your blood sugar, you're in the right spot. By following along, you'll learn about 5 vitamins that can be especially helpful for people with diabetes. When you finish this video, I hope you'll feel confident you have some new tools to better manage your blood sugar levels. Now, let's move straight into the first major topic in this video: vitamin D. It's often called the sunshine vitamin because our bodies make it when our skin is exposed to sunlight. Vitamin D does more than help our bones and teeth. It can also help in the fight against unstable blood sugar. Several studies suggest that low vitamin D levels might make insulin resistance worse. Insulin is the hormone that helps get sugar from the blood into our cells. So when your body doesn't use insulin well, blood sugar stays high. Research in journals like Diabetes Care shows that getting enough vitamin D can help improve insulin sensitivity, which may lead to more stable blood sugar. Also, having enough vitamin D is important for bone and muscle health. If you're active, regular movement helps keep your blood sugar in check, so having strong bones and muscles can support your long-term glucose management. You can get vitamin D from sunlight, certain fish, like salmon and sardines, fortified dairy, and eggs. However, it's tough for many people to meet their vitamin D needs just from food and short sun exposure, especially if you live in a place with less sunshine or have darker skin. A supplement, often vitamin D3, might be worth exploring with your doctor. Doses can vary from 600 IU a day to 2000 IU or more, depending on blood levels and health goals. Before we move on to the second important vitamin, please take a moment to like this video, share it with others who might benefit, and subscribe to the channel. When you engage with this content, it helps us reach more people who want to learn new ways to support healthy blood sugar. Let's continue our journey. The next vitamin I want to talk about is vitamin B1, also known as thiamine. Vitamin B1 is crucial for helping our bodies turn carbohydrates into usable energy. If you have diabetes, you already know how important it is that your body handle carbs well, because carbs can raise blood sugar quickly. When you consume carbs, thiamine helps them break down properly, so they don't just float around in your bloodstream. Another big issue for people with diabetes is that they often have low levels of thiamine because it can get flushed out through urine more easily. Low B1 can sometimes make nerve damage, neuropathy, worse. There is even some research showing that getting enough thiamine might reduce certain diabetic complications, such as those affecting the eyes, retinopathy, and nerves. Good food sources of vitamin B1 include whole grains, like whole wheat bread and brown rice, beans, legumes, and nuts. Some cereals are also enriched with thiamine. If you suspect you're not getting enough B1, you can discuss supplementation with your doctor or dietitian. They may suggest anywhere from 1 millimin to 100 milligrams or more, depending on your situation. The benefits of having healthy thiamine levels may include better energy and reduced risk of diabetes-related nerve damage. That's it for vitamin B1. The key takeaway is that it can help you use carbs for energy instead of letting them spike your blood sugar. Let's move on to the third vitamin on our list. At this point, we're around 1,000 words into the script. Vitamin B12 is another nutrient that's particularly important for people with diabetes. B12 helps your body make red blood cells, supports the nervous system, and plays a role in DNA production. It's also vital for maintaining nerve health. Unfortunately, many people with diabetes, especially those on metformin, a common diabetes medication, may develop a B12 deficiency without even knowing it. Metformin can reduce how well your body absorbs B12 from food. Over time, this can lead to problems like numbness or tingling in the hands and feet, signs of neuropathy, muscle weakness, and fatigue. Research in journals like Diabetes, Obesity, and Metabolism has shown a strong link between long-term metformin use and B12 deficiency. When B12 levels are low, diabetic neuropathy can become worse. On the flip side, restoring healthy B12 levels can improve nerve function and may help prevent further damage. So where do you get vitamin B12? It's mostly found in animal products, such as fish, meat, eggs, and dairy. Vegetarians or vegans can look for fortified cereals, plant-based milk, and nutritional yeast with added B12. Supplements are also widely available, often in doses of 250-500 mcg a day for maintenance, although some people may need higher doses. Some individuals with severe deficiency might require B12 injections. If you're on metformin or have symptoms like numbness or fatigue, it's a good idea to get your B12 levels checked periodically. We've now covered 3 vitamins, D, B1, and B12. Each plays a role in helping you maintain healthy blood sugar and avoid complications like nerve damage and bone issues. Now, let's move on to vitamin C, which is our 4th vitamin. When most people think of vitamin C, they think of immune health, but it also has powerful antioxidant properties. Diabetes tends to increase oxidative stress in the body. Oxidative stress happens when your body has too many free radicals, unstable molecules that can damage cells. Over time, this damage can worsen insulin resistance and contribute to complications like heart disease. Vitamin C's antioxidant effects help neutralize these harmful molecules, reducing the stress they put on your cells. Another thing vitamin C may help with is limiting something called glycation. Glycation is when sugar sticks to proteins in your body, forming harmful substances called advanced glycation end products, AGEs. AGEs can cause a lot of damage to blood vessels and tissues. Some studies suggest that getting enough vitamin C can help reduce glycation, which may protect your cells and tissues from sugar-related harm. You can find vitamin C in many fruits and vegetables, like oranges, lemons, strawberries, bell peppers, and broccoli. While the recommended daily allowance for adults is around 75 to 90 milligrams, some experts recommend higher intakes, 200 to 500 milligrams or more, for better antioxidant support. Just be mindful if you have a history of kidney stones or other issues. Always talk to your doctor if you're unsure about dosage. Sometimes vitamin C is combined with other antioxidants, such as vitamin E or minerals like zinc, to boost its benefits even further. Speaking of vitamin E, that brings us to our 5th and final vitamin. Like vitamin C, vitamin E is a powerful antioxidant. It mainly protects the fats in your cell membranes from oxidative damage. Because people with diabetes often struggle with higher oxidative stress, vitamin E can help reduce the impact of free radicals on your body. Research suggests that proper vitamin E intake could help improve insulin action, although individual results vary. One major concern for diabetics is cardiovascular health. High blood sugar can damage blood vessels over time, increasing the risk of heart disease. By fighting oxidative stress, vitamin E may offer some protection to both small and large blood vessels. Some studies, including one published in the American Journal of Clinical Nutrition, indicate that long-term vitamin E supplementation might reduce cardiovascular events in individuals with diabetes, although more research is still needed to give precise guidelines. Where do you find vitamin E in food? Nuts and seeds, especially sunflower seeds, almonds, and hazelnuts, are excellent sources. Wheat germ oil is also high in vitamin E, as are many other vegetable oils. Keep in mind that vitamin E is fat-soluble, meaning it's better absorbed when eaten with a bit of healthy fat. If you choose to take a supplement, you'll often see doses ranging from 100 to 400 IU per day. Very high doses of vitamin E can interfere with blood clotting, so it's wise to talk with a healthcare provider before starting a high-dose regimen. Now let's pull everything together. Throughout this video, we've gone over 5 key vitamins that can be important for people with diabetes. Vitamin D helps improve insulin sensitivity and supports bone health, which is useful if you want to stay active and control blood sugar better. Vitamin B1, thiamine, plays a big role in converting carbohydrates into energy, which helps prevent blood sugar spikes. Vitamin B12, essential for nerve health and red blood cell production. If you're on metformin, you have a higher chance of being low in B12, which can worsen nerve issues. Vitamin C, a strong antioxidant that may help lower oxidative stress and reduce harmful glycation in the body. Vitamin E, another antioxidant that protects cell membranes from damage and could help reduce complications linked to high blood sugar. While these vitamins can be very supportive for blood sugar management, remember that they are not magic cures. They work best as part of a balanced lifestyle that includes healthy eating, regular physical activity, and following your doctor's advice. Always talk with a healthcare professional before adding new supplements, especially if you take prescription medications or have other health conditions. If you found this information helpful, please don't forget to like, share, and subscribe so more people can learn about ways to naturally support healthy blood sugar. A simple thumbs up from you can help this video reach others who might benefit from it. Thank you for staying with me until the end. Small, steady steps toward your health goals can make a huge difference over time, especially when living with diabetes. Whether you've just been diagnosed or you've been managing diabetes for years, these 5 vitamins, taken through a good diet or with the right supplements, may give you a better edge in controlling your blood sugar and reducing complications. Stay informed, stay empowered, and keep moving forward in your health journey. Every bit of knowledge helps, and I hope this video has made it easier to decide which vitamins might support you best. Thanks again for watching, and I can't wait to see you in the next video.